Welcome to this webinar from Next Practice Deakin. It is Diabetes Week this week, and so we're really delighted towards the end of this week to be hosting a conversation around diabetes, particularly diabetes in primary care and what that means. This webinar's broad webinar really aimed at patients, carers, consumers, registered nurses, and other members of clinical teams involving people looking after diabetes. We're really blessed at Next Practice Deakin to have a wonderful team. And in that wonderful team are also 3 credentialed diabetes educators. So I'd like to invite each one of them to introduce themselves and say a bit about their background and how they're involved. If I can start with you, Ruth, please. Thank you.
Sorry. Hi, my name's Ruth. I'm a credentialed diabetes educator and I've been working in diabetes since 2019. I provide a private diabetes service and my specialty is really type 2 diabetes. That's where my passion is, along with pre-diabetes, gestational diabetes. There's not much more to me than that. Thank you.
Fabulous. Thanks, Ruth. And complementing your diabetes education is that you're a registered nurse and you support a lot of the doctors at Next Practice around doing chronic conditions care plans for all sorts of chronic conditions, including people living with diabetes. Thank you. And over to you, Kanada.
Hello, everyone. My name is Kanaga. I'm a CDE as well as chronic disease nurse practitioner. And I've been nursing for 18 years. My passion about taking care of people include type 2 diabetes, pre-diabetes, gestational diabetes, as well as type 1 diabetes. And I'm newly endorsed as a credentialed diabetic educator. So I'm learning a lot as well.
Fabulous. Thanks, Kanada. And of course, your background is you're a nurse practitioner as well, which means you can prescribe, adjust medications, refer, and so on as well. And last but not least, may I invite you to introduce yourself?
Thanks. Hi, everyone. Welcome to this session and really appreciate you guys coming on. I'm Liz. I'm a nurse practitioner, diabetes educator, and support people with chronic disease across the way. I've been fortunate to be supporting people with diabetes for many years. Do enjoy it. It's a challenge in different ways and looking forward to having this discussion with everyone today. Thanks.
Fabulous. Thanks, Liz. And look, this is a conversation. We've got 3 wonderful experts as a panel, and I've got some questions I'll be asking them, but so can you. There's a question and answer box, it seems. I really encourage you to pop questions in and we'll try and answer as many of those as we can. To get going, let's start with the basics. And Ruth, if I can invite you to speak to this one. For someone who's newly diagnosed with diabetes, what are the first 3 things they should focus on in the weeks after a diagnosis?
So for me with diabetes, I tend to find that when I very first meet someone who's been diagnosed, it differs for every individual. So the focus is on what they're bringing to the table. So I can have some people the very first time I meet them where they're more worried about the actual numbers or they're more worried about the medication. So that becomes the priority of the discussion for that first consult. And over a course of sometimes 2, 3, and I have some people who see me up to 5 or 6 times or regularly, then we cover all the topics that are important to individuals when they're first diagnosed. So for some people, they'll come in and diet is their priority. And other people come in going, my goal is to not be on medication. So I really feel that you have to individualize the important things to those patients with what they're bringing into the table. As a general rule, when someone's been diagnosed, you want to be able to discuss diet, you want to be able to discuss the actual physical and the impact that can have. You also want to discuss things around a lot of the stigma that there is with type 2 diabetes. So, a lot of people go, it's because I've put on weight. Not necessarily. Otherwise, everybody who is curvaceous, which is the word I like to use, would have diabetes. So we have to look at the genetics. So it's really opening it up and normalizing that this is a chronic disease that happens, following the priorities that the patient is bringing to the table, and you will cover everything over a series of appointments. And between diet, exercise, medications, genetics, and I also like to cover like goals. What's that person wanting to do? So, sorry, guys.
Hey, thanks, Ruth. That's a really great beginning and giving us a focus. I'd like to just build up on this idea of goals, which is really important. Many of the people on the webinar today also work in the aged care space or work with older people. I'm just thinking about healthy aging and diabetes, and how do those targets and treatments change as people get older? What are the conversations they should be having with their clinicians about that?
Yeah, that's a really good question, Dr. Paresh. I think it's really important to actually have an individualized care plan. I'm talking goals of care. What are the treatment options? I think it's really important. And I think one size doesn't fit all. So I think it's really important to have that conversation, talking to your patient as well as involving their families, talking about like medication management, for example, and talking about, for example, personal preferences, support systems around the networks. I think it's really important. And we should not forget, it's not just one condition that's affecting their health, or other multiple comorbid health conditions. For example, they probably will have kidney disorder, they probably have heart conditions. So I think it's really important to look at holistic picture rather than just looking at one disease by itself.
Fabulous. So an individualized care plan, focus on what's important to that person, is almost really critical in all of this. Liz, before I come to you, thank you for popping some comments on the Q&A. And just to remind people, we have got the Q&A section here. So if you've got any questions, please pop them in there. Liz is asking a question and would really love to get your answer in this. What do you see as the greatest challenge for you if you're living with the diagnosis of diabetes, or if you're supporting people living with diabetes? What do you see as the greatest challenge? Please pop that into the Q&A, and we can try and respond to that. Liz, I'm gonna throw the tech question at you because I know you're a great fan and advocate of this. But one of the things I think that's rapidly evolving and has changed a lot over the last 2-3 years, is the availability of technology to support people living with diabetes. Things like continuous glucose monitoring. There's the thing that comes to mind straight away, but there's other things as well. Would you like to just comment a bit on the technology that's available for people living with diabetes and the role for that technology in day-to-day primary care and how we support people living with diabetes to look after themselves?
So I think one of the really important things to set the scene in here is that every day, the majority of people in Australia will have access or be using some form of technology, be it using a mobile phone, their cameras at home, their cars even. So we know that around our environment, the technology is very much supporting us where we go to. I'll set the scene by talking about what the guidelines are that our health professionals set for people living with diabetes. And the latest recommendations that are released this year state that an older person living with diabetes that is on medications that might put them at risk of having hypoglycemia, as well as on insulin, should have access to technology to monitor their blood glucose levels. I'm going to stop there a little bit and talk a little bit about the continuous glucose monitoring. Some of you will know about it. Some of you might not know about it. But the difference between doing continuous glucose monitoring, doing a finger prick test, and a blood test is quite significant. And I think the greatest way to think about it is
what you're trying to see. A finger prick test will give you a point in time. It will tell you what it is at that right now. It won't tell you what happened before, or predict what's going to happen in the past. Your blood test that you might have done does a overall overview of what happened over the last 3 months. But if you're smart enough, you can actually manipulate that around and you can get it to do what you want it to do. So the continuous glucose monitoring is a great way for a person living with diabetes, to see what's happening now, what's happened in the past, and what could happen in the future. And Kananga mentioned about how we need to look at changing things as we age. And as we know, as a person ages, there are some cognitive changes that happen. They aren't going to be able to tell and identify if their blood glucose levels are going down. So we do need to look at this being more readily available and being able to be used in many environments. And other things that work alongside the CGMs now is we've got smart pins that will actually connect and tell when you had the last doses of insulin. And it really is another thing that's adding on to our armory. And we'll go on and talk about lots of other things, and you can use the apps these days to look at how you increase mood, to look at your sleep hygiene overnight, which we know is very important. Diabetes. It's going to monitor your heart rate and see what things are going. And then the last little bit to throw in this is the access to insulin pump therapy. So people with type 1 diabetes, it is the best option for anyone that has type 1 diabetes. But that's not to say people with type 2 diabetes can't have an insulin pump as well. And it really does help stabilizing the blood glucose levels. And more those are going to be available. And again, they're changing again to what's actually out there. So mainly our technology is in diabetes is around monitoring the blood glucose and knowing what's going on and then the delivery options around to it, and then incorporating that into many of the other apps and bits and pieces that are around to help people live long, healthy and lives that they're not feeling that they have to be continually checking or someone's checking up on us. It does give people a lot more freedom and confidence to actually live their lives.
Great, thanks, Liz. And it's huge potential, isn't there, for technology, particularly if we come back to what Kanada was saying around individualizing goals of care, and then how that technology supports the individualization of goals. Then we'll come back to you, because looking after diabetes and supporting people living with diabetes is actually a team sport, isn't it? Not one person can't do it alone. And in my kind of view, the actual team needs to include the GP, the diabetes educator, and the patient as part of that team. But who else do you feel needs to be part of that team? And when you're doing care planning and talking to patients around this, who do you talk about as part of that team?
So if we look at the patient being in the center of a circle, and if we look at the patient and the next circle around that, they really need, the team would consist of spouses, partners, family members. A lot of the people that I see to develop a care plan or a plan of action, as I call it, then we actually need buy-in from the people who will support. So if the spouse does most of the cooking, we need the spouse to actually be on the same wavelength. Often the spouses are more on the wavelength than what sometimes the patient can be. So because living with a chronic disease is difficult, we need to have the GP because we need them to know this is what's happening with the patient. This is what we might need to change. The diabetes educator, but we also need to have other allied health involved, because if someone finds that a hurdle to them achieving that feeling of well-being that they should have around their diabetes, then for some people that hurdle might be exercise. That's a hurdle. It's difficult. It's not a motivator. It's not something they enjoy. Then we want to be seeing an exercise physiologist or a physio. With foods, some of us really enjoy those foods that we know are not going to help our diabetes. And sometimes, like the variety that we feel we can't have, the dietitian is the absolutely spot on expert on being able to provide us with choices that we enjoy, because no one's going to go and eat lettuce. No one enjoys lettuce possibly that much. That will control your diabetes, but your enjoyment of food and your quality of life isn't there. So your allied health professionals are really important. But the other thing that's important is you've got organisations like the National Diabetes Services Scheme, and they run programs like the Desmond program. And that's where people have exposure to peer groups and their peers who are also experiencing that journey, their own journey with diabetes. And you've also got Facebook groups. So we've got lots of the circle starts with patients' immediate family, their doctor, their diabetes educator, their allied health like a dietitian. Sometimes a psychologist is really beneficial. And then it just continues to expand out where you might be accessing services from the National Diabetes Scheme. Your pharmacist might become a very pivotal person that you rely on for information. So I think it's one of those things, again, it's individualized, and we just need to make sure that people are aware who they can bring in to their circle.
That's fabulous. Thanks, Ruth. Lisa, I'd like to just come to you. Ruth mentioned the NDSS. We know lots of people aren't signed up or registered with the NDSS. In quick 30 seconds, can you tell us what the NDSS is about and what are the benefits of being signed up to the NDSS?
NDSS is National Diabetes Services Scheme, run by Diabetes Australia, but it's a Commonwealth government supported thing, and subsidises access to pen needles, syringes, test strips, your CGMs, and insulin pump supply. But it's also an organisation for individuals. And one of the mandates of all of this is to providing support for individuals that are diagnosed, whether be it a child beginning towards the end of a life in pregnancy. It's going to give you huge amounts, and it's run by Diabetes Australia, your community organisation, to support the individuals. And you'll find there's a lot of people that will live with diabetes that are actually involved with the organisation.
Right. And Liz, if I was a person living with diabetes, or I was working in an aged care facility where I was looking after people living with diabetes, how would I go about registering with NDSS? What's the process?
So the registration process is very simple. It's a matter of talking to the credentialed diabetes educator, the GPs, the practice nurses, and it's actually doing a form online. So it's completed online 5 minutes, and 5 minutes later, the registration is through. And anytime we have a change in situation, if they need to start on insulin injections, we just update it through that same system. Long gone are the days where we had to fill in forms. Anyone that has any queries, you can go on yourself too. There is a portal for the individuals these days. If you go onto the site, there's an individual portal where you can adjust what you're needing and your addresses and phone numbers and emails as well too, because that's where you receive all your information, and that's your individualized one as well.
Fabulous. So that's really helping you to better look after your own diabetes and live with diabetes. So wholeheartedly encourage it. And if you're not registered, then speak to your GP, a practice nurse, your diabetes educator, in a real simple process to get registered. Nada, coming to you, you've been really supporting us in our patients living with diabetes to create action plans and sick day action plans. Would you be able to speak a little bit more to those sick day action plans you've been creating, both for people living in the community, but also people in residential aged care? What is a sick day action plan? Why is it important? What sort of things are included in that? And how can people in the community use that to look after themselves? And if they're in a nursing home, because I know we've got some staff from nursing homes on the call today as well, how can those sick day action plans support those staff in nursing homes to look after residents living with diabetes?
Yeah, I think it's really important to have an action plan, and especially when patients become unwell. So, in a nutshell, the six-day management plan will give you options of how to manage your hypoglycemias when you become unwell, what medication that you should be taking, and what you should be withholding. Okay, say for example, if you're unwell, having nausea, vomiting, not able to eat, then that plan will clearly outline what medication that you should be stopping and what type of preventative measures that you should be taking on board. And same as hypoglycemia, especially people who are taking insulin with complex insulin regimen. So it clearly gives you a plan of how to actually titrate those insulin. And same with hypoglycemia. I think having an action plan reviewed regularly is really important, and also providing ongoing support and education to your community, especially in a nursing home environment. The care staff should actually be able to understand and when to actually initiate those plans, and also seeking support from us. For example, GPs, credentialed diabetes educator. It's really important rather than just stopping altogether.
Fabulous. And again, if I'm a patient, or if I'm working in a nursing home looking after people with diabetes, how do I go about getting one of these action plans? I think certainly people can come into the clinic, can come in and see Liz face to face and have that. Liz also comes to our nursing homes and does that. You do telehealth, and you can do it by telehealth both in the clinic as well as in nursing homes. And again, Ruth, as part of that care planning process, is that something you'd cover us there as well? So again, really important, really recommend it. And at Next Practice, we're really blessed with a team that can cater to that in a wonderful way. I think also that, Liz, you spoke to, I think it was you, Liz, earlier speaking to, no, Ruth, sorry, about the team sport, the different members of the team getting involved. And Liz put a comment on the chat. Again, we're really blessed, I think, at Next Practice that we have got that team. So we've got diabetes educators, the three of you, a group of nurses who can support that care planning process, and then a physio for that exercise program, a dietitian if you need to see a dietitian, an accredited mental health social worker, and a psychologist if you need that support. Oral hygiene is really important. We've got that oral hygienist in the clinic as well. So this kind of idea of being a team sport is something I think we're trying to grow at Next Practice Deakin to support people living with diabetes. We're getting close to running out of time. So we've got 5 minutes left. If I can come around each one of you around a closing reflection, really. So what is it that inspires you most about working with people living with diabetes, and what gives you hope for the future? And I might come to you first, Liz.
So if we think about hope for the future, one of the greatest challenges is if you are living with type 1 diabetes, or you have a relative or a child with type 1 diabetes, it's about this golden grail, which is the cure. And the hope for the future, and it's getting closer and closer these days, is that we will be able to support the really early diagnosis and actually the prevention of type 1 diabetes. And the trials that is happening. So that would be really good. The other holy grail is that we really concentrate on identifying those that are at risk of developing diabetes early or pre-diabetes, and we put it into remission and keep it that way so that they aren't going to can have a better journey, a safer journey, and don't get the complications.
Amazing. So we can now have the goal of curing diabetes, if I can call it that. It's putting it into a state of remission. Diabetes resolved is a realistic goal. And the earlier someone's diagnosed, the more likely that is, isn't it? With the kind of intensity of treatment we've been talking about in the team-based approach. Kanaga, what about you? What inspires you the most? And what's your hope for the future?
Yeah, I think this hope that I'm expecting is Australians living with diabetes, all type of diabetes, they should have equitable access to technology and services. I think that's really important, whether they live in regional, rural, remote areas. I think that's something that I'm hoping that they all have equitable access to technology and services.
Fabulous. Wins Canada. Ruth?
I think the biggest hope for me, both generally and on an individual basis, is that people with diabetes, regardless of what form, achieve a feeling of well-being, because that feeling of well-being is what gives us meaning and quality to our life. So I think for me, that's the biggest thing, is how getting to that well-being point is what I call it.
Fabulous. And I guess what excites me is the prevention agenda. We focus a lot on people who've already got a diagnosis of diabetes, but actually we can intervene a lot earlier, can't we, as well, and think about that kind of prevention agenda, so we can assess risk around how likely you are to develop diabetes and try and intervene at an earlier stage before it becomes diabetes as well. So again, really encourage people to think about that. And there are some Medicare rebates for people aged 40 to 49 if they're at high risk of diabetes, to have a health assessment every 3 years, come in and get that advice around prevention. So again, encourage that. I guess at Next Practice Deakin, as the team's grown and the amazing skills of you three have come on board, we've started to focus more and more on chronic conditions and diabetes in particular. And we've become a member of the National Association of Diabetes Centers. Liz, can I just ask you to comment a little bit on the benefit and the value for us as a practice, but for the people and patients we look after by us being a member of the National Association of Diabetes Centers?
Thanks. The National Association of Diabetes Centres is a group of diabetes centres, both tertiary, primary care and community, that come together to promote excellence. So it's about, being member of diabetes, the NODC means we are promoting excellence in supporting people living with diabetes at all stages of lives. We are involved in collection of data, which actually makes up what the picture of people living with diabetes actually have, both their psychological well-being, where they're up to, the numbers, who's using technology. And that actually is very important for information that the government use as part of the agenda onto it. And it does drive the push to allow people to have access to appropriate medications, access to better support systems to achieve their goals that we've been talking about. So we're proud to be part of this group and promoting the excellence of care for people living with diabetes.
Thank you, Liz. And with that, can I thank Liz, Ruth, and Kanaga for being such an expert and wonderful panel, putting forward your views in such a simple way that makes sense. So thank you. Thank you for all our participants who joined us today. Thank you for people behind the scenes at Next Practice Deakin, like Shabnam, who's on the call now, and Sushma, one of our enrolled nurses, and all the nurses and clinical staff and allied health at Next Practice Deakin for doing what you're doing and supporting the care of our patients. We will make the recording of this available, and we'll also divide that recording into bite-sized chunks. So we'll break it up by the questions. So if you haven't got a full half an hour to listen to it, and you've got 3 or 4 minutes, you can just listen to the 3 and 4 minutes of that question. So with that, thank you. Have a wonderful Friday afternoon and weekend. And we look forward to connecting with you, supporting your care, supporting you to care for other people you care for who live with diabetes. Thank you.
Everyone, thank you.
Thank you.
Thank you. Bye-bye.